I don't know, was maybe some larger lesson of telling me to slow down in life.
Eric Gilo is not one to sit around. He's always on the go, running mobile strategic recruiting with his wife, staying busy with their kids, and working out.
You know, I had just taken up the sport of boxing, and so I joined the gym, and I was probably very active. To quantify it, probably 3 to 5 times a week. I'd do some pretty high impact, intense workouts.
But Eric had to put his active lifestyle on hold when he ruptured his left Achilles tendon.
I was playing tennis, and it was cold outside. You know, I hadn't warmed up, but I felt like somebody threw a hammer or kicked the back of my leg. I heard a very large snap, sounded like an elastic band snapping.
A lot of times it just happens and there's no rhyme or reason other than they're being active, and sometimes it's in people who are active but they're not always active. They're just active on the weekend or every other weekend, and so, but it can happen in professional athletes too. So
Eric was referred to OrthoArizona foot and ankle specialist Dr. Jason Lake.
He's young, he's very active, he still does cutting and jumping sports, and right now in the United States, most of those people we recommend surgery, but the Achilles tendon will heal without surgery. So the people that end up not having surgery are usually people who smoke, diabetic, vascular disease, people whose hobbies are chess or bingo, things that are low activity. If they end up a little bit weak, it's probably not the end of the world.
Eric decided surgery was his best option.
He felt that surgery would probably be the best, based on the fact I'm active, and number two, you know, studies show that the re-rupture rate is less. So with those factors in play.
Since his surgery in January, Eric went from wearing a cast, then a boot, to finally being able to walk 3 months after the procedure. He is now in physical therapy.
It's just important that he does the right exercises with some supervision. So he's very motivated. I expect him to do a lot of it on his own.
Which Eric is doing. While it can take up to a year to recover, Eric has some advice for those just diagnosed with an Achilles tendon rupture.
Probably number one, to align themselves with an organization and with a leader and doctor like Dr. Lake, just so you can have the proper framework and platform. And then two, just be patient and be grateful for your spouse and for the people that are around you to support you.